Hello and welcome, Inspired Podcast community. This is your new episode. My name is Caroline, and my today's guest is Jenn Johnson, and I'm so happy that she is here and said yes to our interview. How are you doing today?
I'm doing so well. How are you doing?
Wow, I'm fantastic, and I would love to introduce you to the audience, of course. You are a wife, mother of two, and a registered nurse in Ontario, Canada. Over the past 16 years, you have worked in emergency rooms across northern and southern Ontario, gaining first-hand experience in everything from life and death moments to the challenges of working through a pandemic. Your debut novel, Nursing Intuition: How to Trust Your Gut, Save Your Sanity, and Survive Your Career, launches on October 29th. Welcome to the Inspired Podcast, Jenn Johnson.
Thank you so much for having me.
I'm so excited to hear all about your journey, your challenges. And my first question is, what inspired you to write Nursing Intuition and share your experiences as a nurse?
Yeah, so nursing intuition was born out of sheer exhaustion and hitting rock bottom with the pandemic. I was way overtired, so burnt out, and just completely done. And at the time, we had attorneys come forward to say, "Hey, we're so proud of the frontline workers. We'll do everybody's wills for free." And I'm like, "Pardon?" Like, "Oh, we're not expected to survive." Like, "Okay. Oh, yeah, okay." So, you were already scared and anxious and petrified of what would happen because nobody knew. And then you'd had attorneys coming up to say like, "Oh, no, we'll do your wills for free." And you're like, "Okay, so I'm not expected to survive. Perfect. Awesome." And, going day to day and seeing everything, and granted, we were very lucky in Canada in the first year or so, we didn't get hit nearly as hard as the US did. It was petrifying to watch them and just kind of go like, when is this gonna come up here?" And very, very lucky, but still, petrifying because you didn't know when it would happen, if you'd get sick, if you'd survive. And so thinking about that, I thought, if I were to die, how do you explain to a 4 and 5-year-old at the time why I continued to choose to go to work? And so I started writing down my really good stories from, 16 years of nursing and the times that I helped and the times that I advocated, and it very quickly leaned into the not so great stories, the stories of loss, the traumas that I hadn't processed, and I just started writing, and 6 weeks flew by, and all of a sudden I've got all these stories, and I'm going, "Okay, so what do I do with this now?" I'd love to do something with it, but what am I gonna do? And was listening to Llewellyn, who is a metaphysical book, publisher out of the US, and they were having online kind of book fairs, and the one was, Intuition at Work, and I'm listening to this woman speak about her book, and I'm going, "Intuition at work?" I'm like, "I use my intuition every day." I'm like, "Oh my god, that's it." And so I go back and I look through my stories, and every single story, whether it was good, bad, or otherwise, had this little thread of intuition through it. So I thought, okay, that's a theme. Got it. I would love to bring this forward about intuition in nursing, but it's considered a little woo woo and a little out there. And so without science behind me, I don't feel super comfortable bringing this forward. So ended up looking into all these peer-reviewed articles and studies and over a ton of time, and shockingly, there is so much information, not just on intuition, but specifically intuition in nursing, and so I'm like, "Okay, well, if that's it, that's it. I can move forward, I can bring this forward." And, it's no longer just it's me doing it, we're all doing it, we just don't talk about it. So finished writing the book, put it out there, got a traditional publisher, waited 2 years, And just as it was moving into editing, they kind of gave it back to me to say, "Hey, we're actually going back more into physiotherapy books, not nursing books. So here's your book back. Good luck." And "Oh." "Oh, I thought I had a traditional publisher." It gave it a little bit more credibility. I didn't have to pay for anything to get it published. And so, that was May of this year in 2024. And so I'm going, okay, well, I'm not going to wait for another publisher to potentially turn me down. I don't really want to go through the waiting again. So I'm just going to do it. And have pushed through, and everything has lined up magnificently, and it's coming out, and I'm so excited but petrified about everything. But I'm so excited to bring this concept, which we in nursing we all know and love, but we just don't say anything about. And I'd like to bring it forward so that we can at least start talking about it, if not start teaching it to the new nurses.
Wow, I love what you shared. Thank you so much. I did not imagine. So you planned this, or it came to you, the idea for
No.
the book for 3 years or 3 years ago, and then now it's going to be published. And I love your concept about the intuition part as well. You discovered it and then you did research about it. Wow.
It was one of those things where I don't remember writing the stories at all. I remember getting up super early, I remember staying up super late, but they poured out of me, and going back and rereading some of them were tough. But, I truly believe everything happens for a reason, so I'm putting myself out there, and we're moving forward regardless.
Wow, I love that. Thank you so much. And my next question is, how has trusting your intuition played a role in your career, especially during high stress situations?
So, fun fact, the science actually states that in high stress situations, you're more apt to trust your nursing intuition than not. So, those of us who work the ER, the ICUs, high stress critical situations in the OR, that kind of thing, when you don't have the time to second guess yourself, you go with it. You feel it, you get that idea, you run with it, and you just don't have the time to second guess. So those of us working in critical care tend to lean into intuition a little bit more often than those who aren't chronically exposed to high stress. But it's not like they don't have it. We all have intuition. Everybody, especially any woman who over the age of 12, probably knows very well, that feeling of the creep factor when you walk into a room or you walk into a bar and you just like, "Ugh, that guy in the corner, I can't, there's something about him that I'm just not trusting. I'm gonna trust my gut on this one and just avoid him like the plague." And we all have been doing that for so long. So especially us as females, we've already got it more honed than potentially males do. But then bringing it into nursing and making it a little bit more nursing specific has been really interesting. The best place I find that I use my intuition is usually triage. So when people are coming in, they sit down in front of you. We have no previous tests, we have no imaging. They're starting from square one, and I'm just getting the story. And whether people mean to or not, about 90% of people lie to me on a daily basis. And it's just, maybe it's lies of omission, or they're not being 100% truthful, or they've forgotten a portion of the story that's quite crucial that they don't think is crucial, but I know it is. Or they've forgotten their medications and they're not quite sure what they take on a daily basis. Or they've got dementia and they can't fully tell you what's happened. So I'm continually operating under the premise where I'm missing something or somebody's not being fully truthful. And it really does work to my advantage at triage because I'm hearing what they say. I trust what they say to a point, but I'm, always looking for that next thing that I'm missing, which better outcomes are happening for patients that way because I'm not just taking people at their word. or I'm looking for more. And, especially at triage, somebody will come down, I'll get the story, I'll do the vitals, and, it'll just be something where I'm like, I think there's more going on here than I realize, or I think they realize. Maybe their color's off, they're pale or like green or gray, or jaundiced. And you're just kind of looking at them, you're like, I just don't, there's just something more that I'm not getting. And so to be able to have that and trust it, um, far more often than not, has definitely worked out in my benefit, and the patient's benefits as well.
Wow, I thank you very much. For the first time, I understand how this works. I came across this word triage. You say during the pandemic, because it was not before, or I don't know, that you have to sort out or
Yes.
select who is your next patient, who is in the greatest pain or whatever. And now you explain, and now I understand the thing with the gut feeling, because you are searching for the truth. What is the truth, and who am I going to help next?
Yeah.
Best, because you want to give your best, of course, and make the best decisions, right?
I try, yeah, and we all try, right? But it's one of those things where it's just another skill that can help us figure out who really is sick and who, do we need to dig a little deeper versus, usually just kind of the surface level dig that we do in the ER, where you get kind of one complaint, we look at that complaint, and then we send you on your way. Sometimes there's more to it, that we need to kind of look into.
Yeah. Would you say intuition or gut feeling always tells the truth?
I think sometimes it's hard because you've got biases, and you want to not let those biases win. You know, doing lots of self-reflection and education and activities and things. We all have biases, whether it's so for me, kind of a hot button topic for a very long time was drug addicts. You know, I had been kind of played by drug addicts when I first started as a new nurse, and they knew that I was new, and so they would tell you kind of these fantastic stories, and thinking no different and trusting people 100% at that time. You just went with it, and you played into it, and you kind of got taken for a ride. And so with lots of time and education, I'm going, oh, okay, so that's I have to be very careful, because after I figured out what was going on, I overcorrected. And so then, was maybe a little bit less believing of those with addictions issues or homelessness. You know, those were my biases, and those were my hot and button topics. So I've been working quite hard to really realize that, yes, this is a bias of mine that I need to be very mindful of, so that I don't miss anything on that half, because truly the homeless and those with drug addiction, they will have medical needs as well, that if especially if there's somebody who we call frequent flyers, so they're coming in, fairly often. They usually have very vague complaints. We're wondering if maybe they just want to stay overnight, and sleep in a bed or get a hot sandwich or something, and you kind of see them too much so that you become a little bit numb to them, so that when they do come in and they say, "Oh, I've got this like foot pain," and you're like, "Okay, you've got foot pain." Um, and you wanna just skip by it thinking that already know what they want. You have to be very careful to stop and say, "No, no, no, okay, I'm jumping to conclusions right now. Let me actually see your foot." And sure enough, the foot's black, and you're like, "Oh, that's really not good. I would have missed that had I continued on with just thinking that I already knew what you were here for." So it's a very fine line between insight and intuition and bias, and making them all work. And really, when you have that feeling that, maybe this is a population that I have a bias around, take a step back and actually be extra sensitive to those people to kind of overcorrect for your bias. Be aware that, of course, there's always, motives behind how people act. They may be good, bad, or otherwise, but, you're there to help them just in case they have a medical emergency. And heaven forbid, we've heard so many stories through the years of people who've had frequent flyers who come into the ER and they present and they present the same way every time. And maybe they're really rude to staff or violent. And so people don't want to deal with them. And so when they finally do have that medical emergency, we miss it. And the legalities around missing it because they're a frequent flyer, that's a huge risk to be taking. So, we actually had one in one of my first jobs where this gentleman would come in daily, if not twice a day, was homeless, would kind of take you for a ride. So when I first met him, I felt so bad because he was homeless. And so I'm like, let me help you have a shower and we can kind of clean you up and this kind of thing. And he was using a wheelchair, so I assumed he needed the wheelchair. Finish the shower, get out of there. And you can't shower somebody without kind of getting soaked yourself. And so I come out of there and my preceptor's going like, what happened to you? Why are you soaked? And I said, well, I just gave that man a bath. They're like, why? And I'm like, well, I had some extra time and I felt really generous. So, I thought I'd go for it. They're like, he can walk, right? I'm like, what? I go, yeah, he walks in all the time. I'm like, oh, come on. So being played and, whatever it was, and then seeing him for the next 5, 6 years, daily, if not twice a day, we kind of got a little numb to him. And then it took one locum physician, so a physician coming in, just kind of doing one shift and bouncing out, for him to come in and register. And so they actually wanted to triage him. And we had noticed that he was a little bit more off than he normally was, but it'd been a couple years. We're thought, oh, it is what it is. Don't they actually CT his head and find brain cancer? And so we're like, oh man, how long have we been missing this? Because, you look back and then of course hindsight's 2020. Well, his behavior was changing. He was getting a little bit more forgetful and he was less aggressive than he had been previously. And, just sometimes wasn't making sense, but we thought maybe he was taking drugs. We didn't know. So we were making assumptions and we kind of got caught with our pants down. So thankfully he was then admitted. I actually believe he probably stayed in hospital until he passed. But that was on us for missing that.
I see. So you talked about the combination of intuition and gut feeling and trusting as well, and taking a look and not letting the assumptions or prejudices or whatever rule at that point. Then and it's also about competences and responsibility, right?
Very much
Because
so.
you have to know your limits as well,
Mhm.
where or boundaries we say, where what is your task as a nurse and where does it end? When you
Yes.
tell people you can go home, you are not ill or we cannot help you the way you think we should, for example.
Yeah, it's
Yeah.
it's hard when people come in and in their minds, they're having a true emergency. They've read up on Google, they've talked to somebody, and they come in panicked. And a lot of my job is just to kind of calm them down just a little bit so that we can actually talk about what's going on. And so, being able to provide reassurance that you're not dying, being able to, let people know that no, we're still going to work you up. It's going to take time. So the Canadian healthcare system, you're going to wait. Thankfully, most days are pretty good days where you're seen within 4 hours average, if you're not having a true emergency. And so, you're more than welcome to wait. You will get seen. It will just take some time. But in the meantime, we can do a little bit of blood work at triage. We can maybe get some x-rays. We can kind of get things started before the doctor sees you so that when the doctor does see you, everything's already done that we can do. And so it gives people a little bit of reassurance that, yes, we are listening, and we are concerned. And it gives them the reassurance that maybe I'm not as sick as I thought I was. So, getting people calm and going, okay, like, let's try to manage this. Because a lot of people don't know, basic things to be able to manage symptoms at home. So, pain, you can take Tylenol, or I think paracetamol, as well as Advil. You can take them together, and you can take them every 6 hours together. And studies show that they're actually the same level of painkiller as a Tylenol number one, which is you have to ask for that over the counter from a pharmacist. So it's a little bit, kind of a change of pace where people think, oh, I can either take one or the other. Well, no, you can combine them, and they've actually got quite good pain and swelling um, and inflammation, not curing, but um, oh my gosh, of course, then the train of
Reduce
thought goes.
reducing reducing the pain?
Yeah, reduce pain, and they work together. They work differently, so that's why you can take them together. And, taking a Gravol when you're nauseous, Pepto-Bismol if, heartburn, indigestion, upset stomach, diarrhea kind of symptoms. Like, try things at home first before, potentially rushing to your local ER. So it's a lot of teaching, and, hospital avoidance, as we like to say.
Yes, I see, and I didn't know this about the combination of the 2
Mhm.
things, but yeah, I was not in a situation where I needed this, but maybe we don't know. So thank you so much for teaching us today, and I have another question. It is
Sure.
my last question, I would say. What advice do you have for nurses struggling to cope with the pressures of the job, particularly in the current healthcare climate?
You're not alone. You're so not alone. You know, find someone who is in the same situation. So usually somebody who works in the same department as you, or a friend who you used to work with, somebody who you can talk to about the stresses and the strains of what you're doing. Obviously, we don't ever talk about patient names, but you can talk about patients in hypotheticals, um, or just talk about disease process, right? So, had a patient with pancreatitis, this is what we did, kind of thing. Um, and, just know that therapy is there. Everybody needs a therapist, let alone a nurse. A nurse needs two therapists. You need your main therapist, and then you need a backup therapist for when the first one's too busy. Reach out for help if you need it. Take the medications if you need it. It is not a sign of weakness to ask for help and to reach out and to lean on medications if need be, because truly what we see and deal with in a year is insane to start with, let alone tacking on the pandemic and trying to recover from that. So please don't ever feel like you're alone. And if you ever need a shoulder, if you ever can't find someone to talk to that just doesn't understand, please reach out. I'm usually goofing around on my phone, so I'm always here to lend a helping hand for sure.
Oh, thank you so much for sharing and for offering this. Of course, please reach out to Jen. She's amazing. But I also want to know about your book. So your book is going to be published very soon. And the question is, because we will all buy it, of course, and not only reading it, but only also buy a second one to gift it to someone else, right? And so the question is, how can we support you more?
Yeah, so I'm on Amazon. If you search up Jennifer A. Johnson RN on Amazon, you will find not just nursing intuition, but you'll also find a bunch of journals that I have for new nurses and nurses looking to support themselves. I've got a grief journal, a wellness journal, and 100 shifts journal that just lets you allow yourself to watch yourself grow as you conquer the small skills that end up creating a career in nursing. You can find me on TikTok and Instagram at ernurse.jenn, Jenn. You can find me on LinkedIn, Jennifer Johnson, BSCNRN. Do not come for me. There are too many Jennifer Johnsons, so I needed the BSCNRN. And you can find me at RX for Growth, rxforgrowth.com. That's my main website. And yeah, whatever you need, I'm probably on my phone or kicking around because I'm on night shifts usually. So hit me up if you need to.
Wow, thank you so much, and so much for our interview as well. It was a real pleasure talking to you, and now it's time for your last thought to the audience, please.
My last thoughts. Last thoughts are trust your gut. It seems like such a weird concept. It seems very woo-woo, but I promise you, if you start talking to someone you trust in the nursing world, especially somebody who's been nursing usually greater than about 5 years, if you ask them, "Hey, I just don't have a great feeling about my patient. I just don't know what to do next. What do you think?" Chances are, more often than not, your buddy's gonna come see the patient and go, "Okay, you were trusting your gut. Let's go talk to the doctor." And it's very scary to not only acknowledge that that's happening, but then act on it. So just know that it does take time, like any other skill, to hone and to nurture. And the science says, once again, even if you're wrong and you're being overcautious, and that's okay too, just having the doctor take a second look at that patient still improves patient outcomes. So please know that it's not a bother to the physician. It's you advocating for your patient, if nothing else.
Wow, what a great message. Thank you so much. I learned so much, and I love your book,
Thank you.
Birth Intuition. And yeah, thank you for our interview.
Anytime, anytime. So, of course, it's what, 6 o'clock where I am right now, and it's the full moon outside, and so it is so bright. So I'm like, "Oh, I'm so excited that I got to get up and tape an interview during the full moon."
That's
Makes
so
it extra
great.
special.
And I see you in the next episode, of course.